Now, with all the information about this issue with genetic precondition and the birth of the child, then we have the relationship between the mother, father, and the child based on the environment that the child is being brought up and the environment that the mother and father has been brought up and the genetic background of the father and mother, both ancestral and related to the family background. And then you can see how complicated it would become with regard to a approach to a disorder related to food and intake of food, which is by itself, it could be seen as a kind of like a spectrum of obsessive compulsive disorders, especially in eating disorders. Now, the obsessive compulsive disorder spectrum with expression of symptomatology related to inability to be flexible and basically sticking to a pattern of behavior and not being able to be flexible to have a way of managing the environment flexibly so that the individual would get into points of frustration, and because of the frustration then the individual have to pick up a certain aspect of behavior, ritualistic behavior, mannerisms in order to control that environment, which then the expression of obsessive compulsive disorder and the related symptomatology comes up. Again, it's very important to keep in mind that in any kind of a spectrum of obsessive compulsive disorder, since we're talking about eating disorder, which is part of that obsessive compulsive spectrum of disorders, it's important to recognize the factors related to biological expression of this disorder with chemical expression of this disorder and the hormonal imbalance related to the genetic precondition again and the background history and the environment that we are and the stressors that we are exposed to. So we have to keep all of that in check and to keep in mind. Now, it's very important in order to understand one of the basis of the expression of this disorder, basically to, in the treatment setting and in a relationship setting with us related to and dealing with people around us who are suffering from these disorders, to be able to understand and to accept and then to be able to see some changes happening.